Hi everyone and welcome to my channel hubetabibi. This video of mine is about ringworm of the scalp, which is also known as Tinea Capitis in our medical terminology. Earlier I posted a short overview about this illness on my channel. I hope you have already watched that video. Today I am going to present this illness in detail. Well, this is a fungal infection of the scalp and hair shafts. The signs and symptoms of the ringworm of the scalp may vary, but it usually appears as itchy, scaly, bald patches on the head. Ringworm of the scalp, which is a highly contagious infection, is most common in toddlers and school-age children. Treatment for the ringworm of the scalp includes medication taken by mouth to kill the fungi, as well as medicated shampoos that may lessen the spread of infection. Some cases of ringworm of the scalp result in severe inflammation at the site of infection that may cause scarring or permanent hair loss. Now let me tell you the symptoms. The signs and symptoms of ringworm of the scalp include one or more round patches of scaly skin where the hair has broken off at or just above the scalp, patches that slowly expand or enlarge, scaly, gray or reddened areas, patches that have small black dots where the hair has broken off at the scalp, brittle or fragile hair that usually pulls out, tender or painful areas on the scalp. Several conditions affecting the scalp may have a similar appearance. You should see your child doctor if your child has any hair loss, scaling or itchiness of the scalp, or other unusual appearances of the scalp. It is important to get an accurate diagnosis and prompt appropriate treatment. Now let me tell you the causes. Ringworm of the scalp is caused by one of several varieties of the mold-like fungi called dermatophytes. The fungi attack the outer layer of the skin on the scalp and the hair shaft. Ringworm is not caused by worm. The common name for the disorder refers to the ring-like or circular appearance of the infection on the skin. Now I'll tell you how it is transmitted, methods of transmission. Ringworm is contagious and can spread in different ways. It can spread from human to human. Ringworm often spreads through direct skin-to-skin contact with an infected person. Object to human. Ringworm can spread through contact with objects or surfaces that an infected person or animal has touched, such as clothing, towels, bed linens, combs or brushes. Animal to human. Dogs and cats, especially puppies and kittens, are often carriers of ringworm. Other animals that are often carriers of the fungi include cows, goats, pigs, and horses. Your child can contact ringworm by grooming or petting an animal with ringworm. There are some other types of ringworm which I should tell you. The fungi that cause ringworm of the scalp can cause other infections on the body. These infections are generally classified by the part of the body affected. These include ringworm of the body, that is Tinea Capitis. This form causes a red scaly ring or circle of rash on the top layer of your skin. Athlete's foot, which is also known as Tinea Capitis. This form of ringworm affects the moist areas between your toes and sometimes on the foot itself. Well, on my channel hubetabibi, I have already posted a video about athlete's foot, which is available. You can see that video. That is very informative video. And about the Tinea Capitis, I'll post a video later, inshallah. Now there is another type of infection that is known as Tinea cruris, which is commonly known as jock itch. That is also caused by the same type of fungi. This form affects your genitals, inner upper thighs and buttocks. Okay. Now let me tell you the risk factors for the ringworm. The risk factors for the ringworm of the scalp include age. Ringworm of the scalp is most common in toddlers, as I told you before, and school-age children. Toddlers are, if somebody is not familiar, toddlers are usually the children between 1 to 3 years of age. Okay. Another risk factor is exposure to other children. Outbreaks of ringworms are common in schools and child care centers where the infection easily spreads through close physical contact. Exposure to pets. A pet such as cat or dog can have the infection without showing any signs. Children can get the infection by touching or petting the animal. Now I'll tell you the complications of ringworm of the scalp. In some cases, ringworm of the scalp causes carrion, which is a severe painful inflammation of the scalp. Carrion appears as soft, raised swelling that drain pus and cause thick yellow crusting on the scalp. Instead of breaking, the hair falls out or can be easily pulled out. Carrion may be caused by an overly vigorous reaction to the fungus and can lead to permanent scars and hair loss. Okay, this was the complication. Now I will tell you preventive measures, how you can prevent the ringworm infection. Well, ringworm is difficult to prevent because the fungi that cause it are common and highly contagious. You can help reduce the risk of ringworm by some of the steps which I should tell you now. First of all, you should educate yourself and others. Be aware of the risk of ringworm from infected persons or pets. Tell your children about ringworm, what to watch for and how to avoid the infection. Secondly, you should shampoo regularly. Be sure to wash your child's scalp regularly, especially after haircuts. Keep clean. Be sure your child washes his or her hands often to avoid the spread of infection. Keep common or shared areas clean, especially in schools, child care centers, gyms and locker rooms. Avoid infected animals. The infection often looks like a patch of skin where fur is missing. In some cases, though, you may not notice any signs of the disease. Ask your vet doctor to check your pets and domesticated animals for ringworm. Also, do not share personal items. Teach your children not to let others use their clothing, towels, hair brushes or other personal items, or to borrow such items from other children. And now I will tell you about the diagnosis of ringworm of the scalp. When patients, when parents usually bring their children to us, it's very easy to diagnose the ringworm infection just by looking at the scalp. Okay. It's based on visual examination, and then we take a history and we also ask about any source of infection. So usually by history and visual examination it's easy to diagnose, but sometimes we may need to take a sample or hair or skin for examination under a microscope. This test may reveal the presence of fungi and it can help confirm the diagnosis. Now coming to the treatment of ringworm of the scalp. Antifungal medications that can be taken by mouth are used to treat ringworm of the scalp. The medications most commonly prescribed include griseofulvin that comes with the name of Grispag and terbinafine that comes with the name of Lamisil. Your child might need to take care of these medications for 6 weeks or more. Your doctor might recommend that you also wash your child's hair with a prescription strength medicated shampoo. This may help remove fungus spores and prevent the spread of infection to other people or to other areas of your child's scalp or body. Well, this was my video about Tinea Capitis. I hope you have liked this video, and this channel of mine is basically dedicated to help humanity across the world. So please do not forget to share this video on social media such as Facebook and Twitter. And also, if you have if your children are suffering from ringworm, or if you want to ask me about any other illness, you can post your comment in the comment section of this video, and I'll try to make a video about your illness. Or if I don't find a time, I will try to reply to your comment as soon as possible, because almost every comment is replied by me as soon as I see those. Okay, so now I finished this video. Thank you very much for watching this video. See you in next video. Bye for now.